Hi friends, today we are going to see the continuation of the dental amalgam part 2. So in the previous video we have seen about what is the basics of amalgam, the introduction of the dental amalgam, and then we have seen various aspects of its composition and various classification of amalgam and various pictures about it, and we have a brief idea. So here we are going to see about amalgamation reaction. So we all know that amalgam basically contains silver, tin, and then when it's mixed with mercury, it forms an alloy, that is the dental amalgam alloy. And here for low copper alloys, when we see here, the silver and tin together reacts with mercury and forms silver mercury, that is gamma 2 phase, which is the weakest phase. We will be we have seen that in the previous video. Gamma 2 phase is the weakest phase, whereas this is gamma 1 phase. Silver mercury is gamma 1 phase, and this is a bit strong phase, whereas the tin mercury phase is the gamma 2 phase, which we have seen in the previous video also, that is the weakest phase. Silver mercury, that is gamma 1 plus gamma 2, tin mercury plus silver tin, that is unreacted particles are also formed. In fact, they are the gamma phase and they are the strongest of all the phases. This happens in low copper alloys, that is less than 6%. For high copper alloys greater than 6%, that is 29% copper ideally, when silver tin reacts with silver copper and mercury, why here we have given copper is it's a high copper alloy. So what happens is, again silver mercury, that is gamma 1 phase is formed, and then copper tin, that is eta phase, which majorly replaces the gamma 2 phase, which is the weakest phase. That is why the high copper alloys are much better than low copper alloys, in which in high copper alloys admixed is a bit lower than the single composition. Single composition alloys are better. The fact is, wherever copper is higher, it's going to be better. And then we have again the silver tin and silver copper, that is unreacted particles. We have aceties. So that is how high copper admix alloys here we have for high copper single composition alloys. So here almost the same silver tin copper particles, that is straight away we are not adding, we have the whole sum of copper attached to the silver and tin gamma particles with mercury. When it reacts, as usual it forms silver mercury, that is the gamma 1 phase, and then copper tin, that is the eta phase, which majorly replaces the gamma 2 phase, which is the weakest phase, and then unreacted alloy, we have the unreacted alloy aceties. So this sums up the amalgamation reaction, and then we are going to see the very important part of the today's video, that is the different phases and its importance. So during the formation of the amalgam alloy, as we know, the major phase, that is the silver tin gamma phase, which is the strongest of all the phases, and then silver mercury gamma 1 is a base centered cubic lattice. So what is base centered cubic lattice? A lattice is a space So this is a lattice. So what they are telling is, so in a cube shaped lattice, cube where all the sides are equal, so the gamma 1 phase where it forms a, in the base, it's in the center, it forms the base centered cubic lattice in the centered manner, and it's also stronger but not as stronger as the gamma phase. It increases tarnish and corrosion resistance. So coming to the silver mercury gamma 2 phase, so which is, we know, the weakest phase, decreases the tarnish and corrosion resistance. It increases the creep. So what is creep? Creep is the plastic deformation of the object with the matter of time is called creep. So it's just the flow, in layman term, it's just a flow of the object with the matter of time is creep. It increases the creep. Creep is not good for amalgam restoration, and it may lead to secondary carries, and it leads to the failure of the restoration. Coming to the copper tin eta phase, so it replaces the gamma 2 phase, that is the tin mercury, in high copper amalgams, and it is also stronger. It adds up to the alloy, dental amalgam alloy. And copper tin, that is the epsilon, so in high copper single composition of amalgam, not in that mixed, this is at mixed, whereas in high copper single composition alloy there is formation of copper tin epsilon, which is also a good stronger composition. So coming to the trituration part of the amalgam, so here, so let me show you how, with what we do the trituration. See, this is a motor and a pistol, where mechanically the dentist or a dental assistant mixes it with his hand mechanically, and we also have a machinable mix separately. So these are the two types of trituration techniques. So here we use Eames technique, that is equal parts of mercury and equal parts of amalgam alloy. For normally it's done for for spherical alloys, it differs, where 42% of mercury is used. So wherever mercury becomes lesser, first of all, it's whenever mercury goes down in composition, it's not going to be a health hazard. At the same time, whenever mercury gets down, the overall alloy is going to be better. The alloy is going to be much harder, much stronger, and it's going to last for a longer time. So mercury to be lesser as much as possible. So here we are going to compare about lathe cut and spherical alloys. So here in lathe cut there is 50% of mercury content, as we have seen before, but in spherical alloys we have 42% of mercury content. How does lathe cut alloys are prepared? So cast ingot amalgam, that is a fragment of amalgam like this, a fragment of amalgam is cut into pieces, and then various small different irregularly shaped lathe cut alloys are prepared, whereas in spherical alloys they do atomize the liquid alloy. Atomizing is nothing but making it to small rounded spherical shaped particles is atomizing. So that is how spherical alloys are prepared. When comparing the spherical and lathe cut alloys, spherical alloys are better than lathe cut. So lathe cut requires more amalgamation time. We have to keep working on it during trituration, whereas spherical alloys require less amalgamation time. We can prepare it. Here in lathe cut alloys we use small condensers, whereas if we compare to the spherical alloys, there we use large condensers, because in lathe cut alloys there is some kind of resistance to the condensing forces, but in the spherical alloys we have a little bit lesser resistance to the condensing forces, so that when we use small condensers, the restoration gets distracted, so that we use larger condensers so that the restoration is going to be intact. Comparatively, when we see lathe cut alloys, it is of lesser strength than the spherical alloys. Spherical alloys is comparatively of more strength. Setting of amalgam. So after doing the finishing and polishing of the amalgam, so we will be seeing a pic of how do they finish and how do they polishing is nothing but using rubber disc shaped burrs, small burrs, which can be used to polish the amalgam, and we use a kind of small, I will show you the picture. Yeah, small this kind of small brush kind of burrs. So those kinds of burrs are used for finishing the amalgam restoration. They tell it as rubber cups. And then, so during the setting of amalgam, the amalgam undergoes 3 stages. Initial contraction, that is when the amalgam is mixed and it is condensed, what happens is the mercury dissolves or dissolutes, actually the amalgam, the alloy gets diluted in the mercury, so that what happens is initially there is a bit of contraction and then expansion occurs, because the gamma 1 crystals or gamma 1 crystals are formed and they are impinged. So what is gamma 1? You might have guessed, it is silver mercury is formed, and then expansion occurs, and then contraction occurs due to the unreacted mercury. Again contraction occurs. In most of the modern amalgam there is going to be a net contraction. So coming to the type of reactions, so which we have seen before, how does the silver tin alloy, how does it react with the other kind of silver tin alloys, and the mercury acts as a medium here, in between it makes the reaction, and then here we can see how does the gamma 2 phase, and here we can see how does the gamma 1 phase is formed, that is the silver mercury, and then the tin mercury, how does it is formed. and then we have seen this. Here we have the alloy particles and how does the mercury mixes with it, we have seen it. So that this kind of matrix of mercury with unreacted alloy particles and a reacted layer is formed. So we have seen in the previous video also, this is the lathe cut and this is the spherical type of alloys. So here we saw the finishing of amalgam with rubber cups. So finishing and polishing should be done after 24 hours of restoration. Sure, it should not be done immediately, so that if it's done immediately it's going to be distorted. So if you have any doubts, let me know in the comment section. Thank you.